Welcome to this pharmacology series. I'm Dr. Deborah Osei-Sarfoh. I teach diseases and medications, one drug, one mechanism and one animation at a time. Let's learn about Parkinson's disease today. Parkinson's disease is a progressive neurological disorder that mainly affects movement, but also impacts mood, thinking, and autonomic function. In Parkinson's disease, dopamine-producing neurons slowly degenerate. By symptom onset, most dopamine has already been lost. Normally, there is a balance between acetylcholine and dopamine in the basal ganglia. Destruction of these dopaminergic neurons causes too much excitatory acetylcholine, which triggers abnormal signaling. Treatment focuses on restoring balance by increasing dopamine activity and reducing the excitatory effects of acetylcholine. Levodopa is the most effective treatment. It crosses the blood-brain barrier and is converted into dopamine inside the brain. Carbidopa enhances the effects of levodopa by inhibiting the metabolism of levodopa in the gastrointestinal tract and peripheries, thereby increasing effectiveness and reducing side effects such as nausea and vomiting, cardiac arrhythmias and hypertension. Next are the monoamine oxidase inhibitors. MAO-B normally breaks down dopamine in the brain. Selegiline selectively inhibits MAO-B at low to moderate doses, increasing dopamine levels, but it is metabolized to amphetamine-like compounds, which can cause insomnia if taken late in the day. Rasagiline is a more potent, irreversible MAO-B inhibitor, about 5 times stronger than selegiline, and does not form amphetamine metabolites. The next class is the catechol O-methyltransferase inhibitors, entacapone and tolcapone. COMT normally converts levodopa into 3,0-methyldopa, which competes with levodopa for entry into the brain, especially when carbidopa is used. By inhibiting COMT, these drugs increase levodopa availability in the CNS. Tolcapone is associated with severe liver toxicity, so liver function must be closely monitored. Dopamine agonists, such as bromocriptine, ropinirole, pramipexole, rotigotine, and apomorphine, directly stimulate dopamine receptors, providing longer-lasting symptom control, reducing motor fluctuations, and delaying the need for levodopa. Amantadine, an antiviral medication for influenza, was accidentally discovered to have anti-Parkinson effects. It improves motor symptoms by increasing dopamine release and blocking NMDA glutamate receptors, helping reduce rigidity and bradykinesia. Antimuscarinic agents block acetylcholine, producing effects similar to increased dopamine activity and helping restore the dopamine-acetylcholine balance. They are less effective than levodopa and used only as adjunct therapy. Drugs include benztropine, trihexyphenidyl, procyclidine, and piperidine, with side effects such as dry mouth, visual disturbances, mood changes, and reduced gastrointestinal motility. In summary, Parkinson's disease results from dopamine loss and widespread changes in the brain. While current medications help manage symptoms, they do not stop disease progression. Treatment should always be patient-centered, so speak with your doctor or healthcare team to find the approach that best fits your individual needs. Thanks for watching. Don't forget to like, share and subscribe to this channel for more content.